And welcome back. South Africa has joined the global community to observe the International Childhood Cancer Day. The day aims to raise awareness and improve understanding of childhood cancer. Health experts say the disease remains one of the leading causes of death in high-income countries amongst children under the age of 15. Almost 400,000 children are diagnosed annually. South Africa accounts for almost 1,500 of this global number. Many children with cancer in low and middle income countries are either not diagnosed on time or referred too late for curative care. Experts say one of the contributing factors for this is a lack of awareness and knowledge of the early warning signs. They say the most common types of childhood cancers include leukemia, lymphoma, brain, kidney and eye tumours. The Department of Health is working together with the South African Children's Cancer Study Group and Childhood Cancer Foundation South Africa to initiate a program to disseminate information to empower the communities with knowledge about the early warning signs and the unique and complex challenges faced by children with cancer and their families. They also hope to offer support to all children during their arduous journey of this. To discuss the significance of this day, we're joined now by the Chief Executive Officer of Childhood Cancer Foundation South Africa, Hedley Lewis. Mr. Lewis, a very good evening to you. Thank you so much for speaking to us. So the theme this year being hashtag through their hands. Can you just expand a little bit more on this?
Thank you so much. It's really a privilege to be on the show. For us, it's about saying that there are various entities that have played their part. So in the past, we focused on the medical fraternity, on the children that themselves were the heroes. And this year, through their hands, focuses on caregivers, parents, and support structures that have really played a huge impact and continue to support the families through a very trying, anxious, and journey that hopefully will see good prognosis.
I'm just wondering, we're seeing what we're not used to seeing. I'm just thinking of non-communicable diseases, particularly diabetes. We're seeing more and more children who are afflicted by this. So childhood cancer, I'd imagine, is something that's not that common as well. So why are we seeing it now in children?
I think that the reality is that childhood cancer has always been. I think that sadly, as a nation, and as a population, we didn't really want to conceptualize that a child can get, and the awareness has had to be increased in order to destigmatize, de-ostracize, and showcase to the public that children firstly can get cancer, and secondly that if it does occur, that the best thing that you can do is, first of all, know the early warning signs. Secondly, assist with as urgently and quickly as the referral process in order to have the best prognosis for the families and to assist with the medical fraternities engagement in order to help these children.
And I believe the incidence rate of childhood cancer is increasing. Why is that?
I think that what we're seeing at the moment is that the incident rate is increasing. I think one of the things that we need to continue to do is create the awareness, and hopefully we'll be able to see the diagnosis earlier, be able to do the referrals, and hopefully the prognosis. And I think that the key thing around International Childhood Cancer Day is about awareness, education, destigmatization, and holding these families within our heart and assisting them as opposed to shunning them.
The contributing factors for these most common types of childhood cancers I mentioned earlier on, leukemia, lymphoma, brain, kidney and eye tumours. Has science told us what sparks the occurrence?
I think that being non-medical fraternity, and we basically an augmentative body that supports. I think that from our side, I wouldn't want to comment on non-scientific areas, but what I can say is that why the increases, I think that clearly it's showing that we're not diagnosing early enough, quick enough, and that's unfortunately if we should have done that, then the survival rate will reduce as well.
What are you gleaning in the support role that you're playing, the differences between high-income countries and middle to low-income countries?
Well, I think that in high-income countries, the awareness is probably heightened. There's more education surrounding it. And there are challenges with low middle-income countries. I think that from our side, when you're looking at low middle-income countries, we still have challenges of transport for children, housing for children. The psychosocial involvement is a huge priority, and these are the areas that CHOC continues to play a huge role in. For us, it's also about making sure that the families and the public are aware of the early warning signs, the Silla 1 early warning signs. So that should there be an opportunity and a flag that maybe one of these signs is noted by either one of the medical fraternity, an educator, or public, that they are referred early enough. I think that for us as well, to make sure that during the entire duration of treatment, that nutrition is continued to be a priority. And the psychosocial involvement, I mean, one of the things that CHOC prides ourselves is we have social workers and psychosocial workers that are within the tertiary institutions across the country as part of the medical fraternity. So in order to assist and to bring down and to increase the survival rates, we need to continue with these areas, but simultaneously, we need to continue with education, awareness, and advocacy. And as a country, we need to continue to say that we are going to hold these people within our arms as opposed to stigmatize.
And I'm just thinking in terms of middle to low income countries, some of the challenges, particularly poor households would face is, not wanting to take every little mole or signs of possible sickness to the doctor because you can ill afford it. But when should parents start, looking seriously into something and recognize it as something that needs medical attention?
So I think that just very quickly, the Pediatric Oncology Association, our own Department of Health and CHOC many years ago came up with the Silla 1 signs, and S being seek medical advice. That could be in a clinic, that could be with a GP, or it could just be someone that you trust. It could be a white spot that could be within your eyes. L could be a lump in various areas of your body. U is that unexplained. A is aching pains in the various, and neurological is the final N. If any of these signs or symptoms should present for long periods of time or short periods of time, the responsible thing is to encourage that member of your family or society to not take a chance, to go to the clinic, go to the GP, or the other option is to contact us on choc.org.za via our referral webpage, and our team will then engage further and support, and together with the Department of Health and the pediatric oncology teams across the country will assist with either diagnosing or informing the family that hopefully that there isn't a cancer at the moment.
Well, thank you so much for speaking to us, Chief Executive Officer of the Childhood Cancer Foundation South Africa, Hedley Lewis, speaking to us about World Childhood Cancer Day.